So, Kevin, you touched upon some of the cannabinoids like THC and CBD. Can you talk about, sort of what they're used for and maybe touch upon like the other maybe minor cannabinoids?
Sure. Yeah, and THC is probably the most well known, but THC and CBD are the primary two. There's something like 117 different cannabinoids that have been identified so far, and they're learning more about the plant all the time. So there's lots of stuff going on inside the cannabis plant. But the big ones I would say are THC and CBD, and then relatively newer on the market would be something like CBG or CBN or CBC. And these different cannabinoids are used for different purposes. There's definitely some overlap there. THC, as I said before, is the psychoactive component, so that's where the high is coming from. But it's also where the majority of the pain relief is found. So patients dealing with chronic pain or pain conditions, incorporating that THC helps to address the pain symptoms. THC is also where the majority of the appetite stimulation comes from. It can help with nausea, and it also can help with sleep issues as well. CBD is used more on the relaxation side of things. So with CBD, we're looking at managing anxiety or PTSD related symptoms, muscle spasms, can help with nausea or seizure conditions. It's also have some mild pain relieving effects and can be utilized also to help kind of offset some of the potential side effects of THC. CBN or cannabinol is one of the newer ones on the market, just the last couple of years, and you'll see CBN with sleep-specific products. So cannabinol is a slightly psychoactive cannabinoid, and that's because it's formed when THC breaks down. So over time, THC degrades into CBN. So if somebody has a bag of weed that's been sitting around for a while, it's probably going to make you pretty tired because that THC has started to convert over. But on the medical market, you'll see CBN with sleep-specific tinctures or sleep-specific gummies because it can help to address pain, but also it causes some drowsiness. So you'll see it in those products. CBG, cannabigerol, is often called the mother cannabinoid because this is one of the early cannabinoids that forms when the plants are really young. And as they grow, that CBG is metabolized into the other cannabinoids. So it's metabolized into THC and CBD and some other things. But CBG does really well with inflammation. So it's not quite as common as the other three that we just went over, but CBG is great for pain and an anti-inflammatory product. And then probably the only other one that could be in that top five is CBC or cannabicramine. And CBC is, again, used in the anti-anxiety and relaxation type effects. One of the things where CBC is somewhat unique is it can stimulate progenitor cells in the brain. So it's being explored right now, specifically with patients who have cognitive degeneration. So Alzheimer's dementia patients would be perfect candidates for CBC. That one's a little harder to find, though. That's not very readily available.